Okay, welcome to IET for you. Today we are going to discuss about how to write an introduction to writing. Yeah, write an introduction to your OET letter. Okay, so let's see what are the important components you have to include in your writing introduction. Okay, so while writing, so the key informations you should include is the essential components are you should clearly state the purpose of the letter. Okay, so the purpose of the letter is either mentioned in the writing task, or you can identify this from the case note. Okay, then next thing, provide key details about the patient. Okay, so so uh, so these are the important things. Then we will see what are the four important key informations you need to include. Okay, the first one, purpose of the letter. Okay, so you should explain or clearly explain why you are writing the letter. So that is the reason for your letter, like whether it is referral, transfer, or an update if stated. Okay, use formal and concise language. Okay, so writing the letter, example, I'm writing to refer Mr. John Smith, a 68-year-old patient who requires ongoing management for his newly diagnosed type 2 diabetes. From this example you can see that the patient Mr. John Smith is refer, so that we are going to writing to refer Mr. John Smith for what purpose. Yeah, who requires ongoing management, so needs ongoing management. That is the actual reason of this referral letter, so that you have to mention in your introduction. What are the second thing? So second thing is patient's name and age. These are the key important informations. You can skip the age of the patient because sometimes we usually write the date of birth or age of the patients before introduction. So you don't need to include always the age of the patient, but it is definitely have to include the full name of the patient. Okay, so this helps the recipient quickly identify the patient, so that without the patient's name you can't write letter, simple as it. So example, I'm writing to update you about Mrs. Emily Carter, a 72-year-old patient recovering from hip replacement surgery. So here you can see that patient's name and age is written in the introduction. Okay, so third thing, okay, medical condition and reason for writing. So always mention the primary medical issue or condition, like, okay, so clearly indicate if the letter is for referral, discharge, or an update. Example, I'm referring Mr. David Lee, a 45-year-old teacher who has been experiencing persistent chest pain suggestive of angina. You can see that in green color that the medical condition of the primary medical condition of the patient is mentioned in the introduction. So that means that introduction has got the all three important informations, like patient's name and why I am referring, and requires further cardiology assessment, because that is the purpose of the letter. So it's all included, these three important informations: patient's name, and whether if you can include the patient's age as well, as it is 45-year-old teacher and who has been experiencing persistent chest pain suggestive of angina, that is the medical condition. Okay, so and a reason for writing is and requires further cardiology assessment. So these are the three important things. And the fourth thing, if mentioned, if applicable, always mention the urgency. Okay, so urgency is like immediate action is needed or not. Mention that urgency of the situation in the letter. Okay, for example, I'm urgently referring Mr. Alan Brown, a 56-year-old patient with uncontrolled hypertension, for immediate evaluation and management. That urgency is mentioned in a different word here, in immediate evaluation and management. So you can identify from this introduction that this patient, that Mr. Alan Brown, need an urgent or emergency care. Okay, so that is the purpose of the whole introduction. So you can see there are different kind of introduction. You can write it in different way. An introduction like, I'm writing to update you on the recent hospital admission and discharge of your patient, Mrs. Elisa Harper, who was admitted on 20th January 2025 due to an exacerbation of osteoarthritis causing severe knee pain and impaired mobility. For this is a case note we provided in our blog, iet4u.blogspot.com. So you can go and see this new case note in for Miss Elisa Harper there. So I'm providing you three different types of introduction for that particular case note. So here I'm writing to update you on the recent hospital admission and discharge of your patient, Mrs. Elisa Harper, who was admitted on 20th January 2025 due to an exacerbation of osteoarthritis causing severe knee pain and impaired mobility. Let's see the second introduction. Okay, the second introduction is I am writing regarding Mrs. Elisa Harper, who was admitted to Chelmsford General Hospital on 20th January 2025 with severe right knee pain and limited mobility due to exacerbation of osteoarthritis. So again, we are writing in 2 sentences. She is being discharged today after receiving treatment and pain management. So all of these different types of introductions, we are including most of the key informations like what is the patient's the purpose of the letter and patient's name. Not included the age always. I already told you don't want to include because the date of birth or age is we usually provide in the construction before we start with the introduction. And what is the purpose of the letter? Okay, so and the primary medical condition of the patient as well. So and the type. Okay, let's see what intro 3 can do. I'm writing to provide details about Mrs. Elisa Harper, who was admitted on 20th January 2025 for the management of a significant exacerbation of osteoarthritis in her right knee. So, and again in 2 sentences, she is now being discharged following successful treatment and stabilization of her symptoms. From these introductions, we can identify these key points. Always it should be keep it clear and concise. Okay, include patient's name, whether needed age and medical condition. Specify the purpose of the letter and mention urgency if necessary. Okay, these are the all important key points you should understand and write and included in your introduction. So if you included all these important key points in your introduction, the higher chance you're getting the score 3 out of 3 in your introduction. Okay, so thank you for watching the video and please subscribe for more videos like this. Thank you.